Right, so I want to present you this case that I've done. It was 60 years female. She has severe fractures for upper and lower front teeth and some leaking fillings on the upper left-hand side and lower left-hand side, and old porcelain fused metal crown on the upper right-hand side with a margin that she didn't like, so that she also want to be replaced. On the upper left-hand side, 2 premolars. They already got nerve infection, so she needed root canal on these 2 teeth as well as the lower premolar. Then we did a diagnostic wax up and present the case for her. She accepted it and we did full crowns. Then the final result that we had then was a porcelain crown on the upper first premolar on the right hand side all the way to the second premolar on the left hand side, a lower porcelain crown on the lower second premolar and a porcelain inlay on the second molar. Eventually she would come back and restore the lower teeth, but at this stage she just wanted to fix the upper teeth.